everyone, my name is Rainjan Saidi Argota from BSN2 12G, and today I am going to perform the BLS for the newborn baby. So, what is BLS? BLS stands for Basic Life Support, which refers to the type of care that a first responder, healthcare provider, and a public safety professional can provide to a person who is experiencing cardiac arrest, respiratory distress, and obstructed airway. So, what is CPR? CPR stands for Cardiopulmonary Resuscitation, or CPR, is an emergency life-saving procedure performed when the heart of a person is stopped beating. So immediate CPR can double or triple the chances of survival of a person who is experiencing those life-threatening experience. So now we are going to start our procedure. So for the first thing that we are going to do with the procedure, we need to evaluate the newborn's transition to extrauterine life using APGAR score. We need to check for the appearance, pulse, grimace, activity, and respiration. So what is the importance of APGAR score? So APGAR is a quick test performed on a baby after 1 to 5 minutes after birth. So the 1-minute score will determine how well the baby tolerated the birthing process, and the remaining 5-minute scores tells that the healthcare provider will evaluate how well the baby is doing outside the womb of the mother. So, for the second step that we are going to do is we are going to check for the responsiveness of the newborn by tapping the shoulder, rubbing the sole, and calling out the baby's name. Baby, baby, baby! And we are going to check for the pulse. If there is no response, position the newborn on his back and then call for help. Activate the cold blue and Dr. Squeak. Dr. Squeak, cold blue, we need emergency response. The baby needs our help. So open airway and suction necessary, if necessary. So open airway of suction necessary. Positive pressure or PPV using pediatric bug valve mask or BVM initiated if apneic and bradycardic. So attach the BVM oxygen cylinder with 100% oxygen, covers entire mouth, and assuming that this is the BVM, entire mouth and nose with BVM. Allow 30 seconds of ventilation or 40 to 60 breaths per minute. So look for chest rise with each bagging. So have someone to attach the cardiac monitor and pulse oximeter. So assuming that my co-nurses is putting the cardiac monitor and the oximeter, cardiac oximeter, and for the cardiac monitor. So for the next thing that we are going to do is we are going to do the gentle chest compression if heart rate is still less than 60 after giving the PPV. So use either 2 or 3 fingers or 2 thumb techniques when doing the compression. So I will use my two fingers for the compression. Place the compression fingers at center of the chest below the nipple of the newborn. Press down approximately 1/3 depth of the chest and about 1.5 inches. And then observe 3:1 compression to ventilation ratio, completing the 4 cycles in 2-man rescuer. So now I'm gonna put my 2 fingers here below the nipple of the baby and start the compression. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. Giving 2 rescue breaths. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. Giving 2 rescue breaths. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. Giving 2 rescue breaths. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. Giving 2 rescue breaths. So after doing the 4 cycles of compression, evaluate the heart rate after the 4 cycles. If the heart is still less than 60, continue the chest compression, assess for intubation, and giving meds. So if the heart rate of the baby is more than 100 beats, let's proceed to the resuscitative care. We are going to remove the we're going to stop the ventilation, and we will prepare the baby and give to the mother for the skin to skin contact and for the mother's. And then, we will going to document the time, procedure, assessment, responses to the treatment and medication given to the baby. That's for BLS for the newborn. So again, my name is Rainjan Sairi Argota from BSN2 12G. And you do have a great day, everyone. Goodbye!